That's legit right there. That's like a music stand that got converted into a microphone holder deal. That's cool.
It was made by an engineer at Channel 8 about 18 years ago.
Wow.
And that's still the original
So that's pretty durable too, huh? All right, just let me know when you're good to go.
We're 2 minutes early.
That's okay. We can wait.
Hey, Ryan.
Yes, ma'am. Money in here?
Absolutely not. Do people carry cash anymore?
Okay, you see Channel 8, WBAP, or Spectrum.
Hey, good morning,
Spectrum.
Chief. How are you? Good to see you, brother.
Didn't recognize him.
Oh no, you're always helpful with
I don't remember which
operations
channel.
and stuff.
As you might imagine,
It's good.
I'm not a news person.
Oh, gotcha.
But it's a nice day. That's a good thing.
Yeah.
Let me know when you're ready to go. I'll let you kick it off.
Is everyone good? Everyone got white balance and everything? All right, we'll go ahead and get started. I'd like to introduce the Mayor of Dallas, Mayor Johnson.
All right. Let's see if we can get as many questions answered about what's going on here as possible. So I'll just jump right to questions.
Well, can you talk about the process for getting a vaccine here? Is it the same county registration system?
So everyone that I'm aware of is drawing from the same registration system that's doing vaccinations. If you've received vaccines like we have from the state of Texas, no one I'm aware of, including us, is creating any type of alternative registration system. So we want to be very clear about that so people don't get confused. I know that has been a point of confusion for some, but we can't say it enough. There's just one registration system. And so the names we're working from are all being pulled out of that same system. That has not changed. As far as the process itself, the physical delivery of the vaccines, that is different here, and I think it's proving itself to be quite effective. I just went and toured it myself, and everyone inside is pleased and happy with the flow. It's comfortable, and I'm told at this point it's averaging about 20 minutes from the time you walk in the door to getting the vaccine in your arm, and then the mandatory 15-minute observation period. So it's running extremely smoothly.
We don't expect you to be a medical professional, but what impresses you about that the most? About the point that you just made about that time frame?
So I think, again, thank you for pointing out that I'm not a medical professional, but I am I'm a person like most Americans who don't love waiting. So we wanted to make sure, to the extent that we can, we do this as quickly as possible and have the most comfortable experience and offer our residents and those who are coming to get vaccinated here a comfortable and pleasant experience. And from what I've been told, I've talked to people who are in the line, I've talked to people who were inside. This is just me communicating with them. They're happy. And I think that being able to get a life-saving vaccine in under an hour is not a bad thing. And so I would say that sounds pretty good. I mean, I've not seen any data comparing, what the speeds are at every site in the state to say where we stack up. But I can tell you anecdotally, I didn't hear a single complaint. And I think under an hour is pretty darn good. 20 minutes in the line, 15 minutes for observation is nearly 35 minutes once you're in the door.
How many vaccinations do we expect today? How many vaccinations we expect today in this site?
I can let someone from Methodist tell you what they anticipate they might be able to get to, but they have 3,000 vaccines to distribute, and the last number I heard was they'd already gotten through over 600. So I'll let someone from Methodist confirm that that's right. So that's where we are so far.
What have you learned here today that you can carry away to the next vaccination?
So I think what we're learning as we go. I want people to keep in mind that the city of Dallas is not a health authority, and we've been in the vaccine distribution business for now a whopping 5 days. And so we're learning from all of these experiences, and we're getting better, I think, at delivering these vaccines faster and more efficiently. So between what we saw at K. Bailey Hutchinson, which again ran actually very smoothly for a couple of days, had the hiccup on Saturday, and now has been largely running smoothly from what I understand yesterday, and what we've seen so far here today, I think what we are coming close to is having an infrastructure for distributing vaccines that will be able to scale up. And that was the goal. We wanted to expand to Methodist because we knew at some point there's a good chance we'll get more vaccines, and we can't have the bottlenecks that are created both, from a traffic standpoint and whatnot by having it all at the K. Bailey Hutchinson Convention Center downtown. So this is a first step for us as a city in scaling out our delivery infrastructure, and hopefully if we get more vaccines, we'll be looking at other sites throughout the city to be able to deliver more vaccines at scale.
Can you elaborate a little bit more about the importance of the marriage between you guys and Methodist and that kind of thing?
Absolutely. I think it's important for the community to know that outside of this pandemic, Methodist has been a great partner to the city of Dallas and to our community, and has delivered wonderful health services for a long time. But Methodist stepped up and actually approached us and asked us if there was anything that they could do to help. And we told them we were absolutely in the process of evaluating sites and that we wanted to talk to them. And it came together very quickly. It turned out to be a natural partnership for both organizations. So we're very grateful to Methodist, and this is working out wonderfully. The location is one that we're very happy about because of its central location and its proximity to some folks in our community that we're concerned about getting the vaccine to. But they have the expertise is the main thing. They know what they're doing. And if you go inside and look at it, you can see that in action. They've got folks mixing the Pfizer vaccine, which requires a certain amount of expertise to get that right. And they're getting it distributed very quickly. So we're very happy.
Just a little on the exact process, the partnership. You guys are allocated a certain amount, you guys meaning the city, a certain amount of vaccine and giving some of that to Methodist. Can you just expand a little on the exact specifics?
Sure. So the way the state is handling distribution right now, they're giving fixed quantities to entities to distribute. And if you want to do any deviation from that, it's always a good idea to run that by the state, because as we've seen in a situation with the county, the state didn't like an idea the county had about how to do their distribution. They told them that they might take their allocation away if they didn't change it. So we've been very proactive, and we've approached the state at every point about everything we've wanted to do. And one of the things we approached the state about was partnering with Methodist to take the 5,000 vaccines that we were allocated, which is in addition to what the county has been allocated. So this didn't come out of anybody else's allocation. These are 5,000 additional vaccines that are going into our community because we asked. So the 5,000 have been divided. 2,000 are being distributed by the city of Dallas at K. Bailey Hutchinson, which, again, as I've been told, is running much smoother. And so you can go look at that right now, and check it out. But I'm told that's moving very well. 3,000 have been allocated to us that we have given to Methodist to distribute, and they are at the pace of distributing them very rapidly. As you can see, like I said, it's 10:30, and they probably eclipsed 700 by now of the 3,000 that they have. So it's going very well.
What is the plan for the next few days as far as that operation goes?
Correct me if I'm wrong, but I believe we have a plan for the 3,000 that are allocated to Methodist to be distributed by the end of this week here. So over the next 2 days, it was the plan for them to have their 3,000 distributed. But I'm happy to let Chief Stidham speak to that, just in case I'm off about that, but I think that's right.
That's correct. I'm Brett Stidham, Chief of Staff for Dallas Fire Rescue. So the plan is for Methodist to distribute through Friday, and at K. Bailey we'll have ours completed. We'll have our allotment completed by the end of the day.
Mayor, we have the infrastructure. What do we have to do as a city, as a county, to get more vaccines? Because it seems like we have places but we don't have enough. What do we have to do as a city and as a county to get more vaccines?
I really appreciate the question. The question was, what do we have to do to get more vaccines out into the community? And the bottleneck is really the supply of vaccines. That is absolutely the case. I think Methodist is here and could speak to this themselves, but I think every institution here locally that has vaccines that are distributing it will tell you that we could do more. We could actually put through more vaccines if we had them to do. The big limit right now is just the allocation itself. So we are going to be advocating on behalf of our community for more vaccines from the state, and I believe the state is advocating to the federal government for more vaccines to be allocated to Texas. So that's really kind of the chain. We've got to get more vaccines here to distribute, but we have the capacity to do more, and we are already, and we have been for weeks in the process of scouting sites like Methodist and like others around the city that would be able to be brought online to help scale up our distribution.
When you talk about the KB Hudson Convention Center, it's smoother. Do you have to know, like you say, if it's more because people are listening if their appointment is canceled, or people are just not showing up like they were last week?
I'll let Chief Stidham speak to what he's seeing out there, but I can't emphasize enough that the big challenge. I said the big limit to getting more vaccines out is having more vaccines. That's a true statement. It's also a true statement that I think the biggest challenge that every entity has found that is in this business of distributing vaccines right now revolves around the scheduling part of it. Getting the word out to people that they have an appointment, they need to come, because we've had some challenges we've seen at the county, and of course we had the situation at the K. Bailey Hutchison Convention Center on Saturday, where there has been some difficulty with people showing up without an appointment, and whether or not it was clear to them that they didn't have an appointment or their appointment had been canceled. So that's really where I think the biggest challenge has been, and that's being worked on. I'm not in the procurement side of things. I don't get involved in picking vendors and things like that. But I think that is going to be a major improvement once the city, county, and every entity has the best scheduling interface possible to make sure that there's not any confusion around who has a valid appointment or not. But that is something that just has to be worked through. It just has to be worked through.
I was on the side where people are arriving. I was there for 30 minutes, and I only saw one person from the Hispanic community. Only one person in 30 minutes. It seems like they're not responding. What do you think about that?
So I will speak to the messaging part of this, but I think someone who has expertise in how people are being pulled out of the registration system should speak to that. But I can tell you this. I have been saying in daily meetings with city staff and our joint meetings with the county that we have to take on this messaging challenge in a more macro way and make it more of what I would just call a mass communication strategy. I mean, we really are going to have to start assuming that certain people in our community are only going to hear this message if we just bring it into their TV set or in the mail or something that's very passive. I mean, they don't have to do anything. The information is just going to come to them regardless. I don't think we can rely on people exclusively showing up and coming to a vaccine registration site. If they've done that, they've already demonstrated some degree of mobility and some degree of access to information. We're going to have a more concerted effort at every level of government and with influencers of all types, including entertainers, whomever, to get to people on TV, on the radio, in the mailbox, that they need to register, since again, we have one registration system, just one. So we can have the names to pull from. We can't pull a name that's not in the system. It's not possible. So that's what I would say to that. But would someone like to speak to how we pull the names out, or how the Methodist is handling scheduling?
Good morning, welcome all. My name is Jim Skog, and I'm the Chief Executive Officer for Methodist Health System. And we do pull names from the county list that is provided by the city. We establish individual appointments, so as you might expect, since this arrangement was just worked out over the past weekend, that our staff has worked tirelessly and virtually around the clock over the last couple of days, scheduling literally thousands of patients to come through today and tomorrow. It's entirely likely that we will administer all 3,000 doses. However, if not, we will extend the hours or extend the day or two and continue to push those doses out, because that's the whole purpose of this endeavor. The other point relative to the numbers of doses, we thank the mayor and we thank the city for gaining access to those additional 5,000 doses per week. We're delighted as a health system to be able to serve the citizens of Dallas and beyond, and particularly the southern sector of Dallas. I will say that from a Methodist perspective, we have applied for hub status. We have the capacity to push through literally thousands and thousands and thousands of doses per week, much more capacity than we're even using today and tomorrow. And we're very hopeful that that will be shortly forthcoming, and that we will have that opportunity for hub status. There are a couple things that we are thinking through and planning on doing, and even experimenting with early and then doing more of it, would be pop-up registration sites. And taking those pop-up registration sites to areas where some of the more challenged communities within the southern sector of Dallas, where there may not be ready access to a computer, there might not be ready access to an iPhone in some instances, or good internet bandwidth, to be able to log on and do the things that need to be done. So our hope is, once we get a more predictable level of supply and a more robust level of supply, that we will be able to do some of those things that we think will be creative and will do more to increase the penetration rate of registrations from some of those most underserved areas.
So can I ask about, so you have this database from the county, are you able to then filter by race or ethnicity to get all those specific folks that are in the harder hit areas?
When we go through the list, and by the way, this is Pam Stoynoff. Pam is our president and chief operating officer, and she's the architect and the leader of this entire process that we've been able to establish within the Methodist Health System. My understanding is that we take that list, we go through the list kind of in order, Pam, if I'm not mistaken, and we get these patients registered, and I'm not even sure we know what the ethnicity may be of the patient that we're talking with, or the person that we're setting an appointment for the potential vaccine. But I will say this, very early this morning, Pam's been there all morning, very early this morning I went down for 30 to 45 minutes, and I was so gratified because of how this virus has impacted disproportionately people of color. I was joyful over the diversity of the group that we were serving down there, and those who need it the most and are most disproportionately affected. So we're not keeping a log, we're not keeping a running tally of exactly who we're serving. But my anecdotal information is we're reaching many that otherwise would not have been reached in this process.
The state is saying that the reason why their data is incomplete about who's gotten vaccinated, 45% of folks in early data have no race or ethnicity data tied to it. They're saying it's because providers are not gathering that information. Has the state?
They are now.
We are now.
You are
yeah,
now.
we are
if
now.
Someone gets vaccinated, you're logging their race or ethnicity.
So that's great. So as we book the appointments, we don't know for whom we're booking that appointment except by name. But then once we have booked that appointment, then we are gathering that information by race. And so I think some additional information will begin to roll out.
When did that begin? When did you start doing that?
This week.
Yeah, we just started working the state list this week. Prior to that, we've been doing our Methodist family. And just one point to say on the, one point to say on the pop-ups and things like that, in an effort to get to the communities that are difficult to serve because they don't have access. They don't have access to get on a county website either, or anybody else's. And so, but that needs to work with the county, for all of us to work with the county to have them let us have some flexibility in how we access the market for the people that we're trying to serve, right? So the pop-up sites, we're ready to do those. We have the ability to do those now. We'd love to try them right away. We have sites around the city where we know that people have access problems, but we've got to, along with the city, have the county allow us to do that, because those folks that will register won't be on the list, right? Because they don't have access to get on a list, but they need the vaccine. So we want to be able to do some of that, certainly not exclusively, but some of that would be helpful.
So the county, you need permission from the county to register people for their database, you're saying?
If they're not on the database, because we're using the list the county provides us, right? So if you want to get people that don't have access to the internet to go and register on the county, how do you do that? So we can register them directly with Methodist, forget the county list, right? And I'm not saying forget the county list, but to get other people, we go to them. They don't have access to the internet or a phone or whatever. They walk into a Walmart, we register them, then they know where to go and they come here and get their vaccine.
Can you register them on the county's list? You know what I mean?
Well, we probably could, but that's it's an effort, And if we're trying to push vaccine out and get a little bit more efficient, effective, then you don't. Your own list, and we'll track all that. We have to report it to the state anyway, so we track it all anyway, so we don't have to duplicate.
And I think just one other point, given our proximity to the southern sector of Dallas and southern sector of Dallas County, our hope is by continuing to vaccinate here at Methodist Dallas and then possibly beyond, once we get a predictable supply of vaccines, that access and that proximity to the southern sector of Dallas through this location and other locations that we have and other locations that folks are willing to allow us into will better serve that community.
I want to have Rocky, you want to speak to that a little bit too? Or Chief Stidham.
Hey, Rocky.
And then we'll take one more for the mayor because he's got to run.
Is there a specific question, or do you want me to expand on what? Okay, so we're all using one central database that people are registering at Dallas County, and we are pulling from that list. Now, within the 1B category, we are further refining that list, adding vulnerability index, proximity index, age that's there. Right now, we are looking at where we are on that list is 68 and above. At some point, it'll come down to 65 and above. And that's what Methodist is using from that main database. That's what we are using at a convention center. That's what the county is using for the Fair Park site. Additionally, UT Southwestern, Parkland, and Baylor also use that same list when they have extra vaccines to give out. So we're all using one centralized database. Again, as everybody has mentioned, the first step is for people to get registered on that site. If they're not on that list, there's no way for us to schedule an appointment for them when they are eligible to get the shot.
I wanted to ask you about the special committee meeting today. What is your take on this proposal to put a $300 million fund for streets and traffic signals?
Well, first of all, I commend Chairwoman Mendelson for bringing that idea to the committee that she's the chair of to discuss. I've been a pretty strong advocate for more policy ideas at City Hall being vetted through a committee. That's my background in the legislature. Ideas need to have some expert weigh in and needs to get the vetting that a committee can provide. Committees have the time to spend that we don't have at the Horseshoe when we are meeting as a full council to really dig into the weeds on something as important as issuing more debt that will ultimately have to be repaid by the taxpayers of Dallas. So I commend her for taking it to a committee as opposed to trying to just stick that on the full council's agenda. I look forward to hearing what the committee has to say about it and the ideas that come out of that conversation. I also look forward to the input of the city's chief financial officer and the city's debt manager, the people who actually we pay to pay attention to our city's debt load and to understand what our debt capacity is and to understand the advisability of going to the voters with a bond proposition. So I'm going to be listening to the committee's discussion. I'll be wanting to hear from the CFO and our debt manager about this, and then we'll see. But it is undoubtedly the case that we are underfunding our infrastructure in this city to the tune of $50 million a year, and that it has caught up with us, and that we are competing with surrounding municipalities that have made the necessary investments in their infrastructure. And so that's the situation. the issue will be, what is the best way to address that underfunding? Will it be through the issuance of some debt or changing our budgetary priorities?
Thank you all.
Thank you, guys.